I'm Santhosh Kumar Gupta, a retired naval officer. I decided to come to Narayana Hospital in Bangalore for my knee operation. That took me many years to decide to have a knee replacements. The reason is that I was otherwise quite fit and I had no problems, medical problems. And although I'm 87 years old, my problem seemed to be only that my knees were giving a lot of problem. And I was not enjoying walking at all. In fact, it was like a punishment to me if somebody said you better walk a little bit, and I just didn't like the idea. Both the knees were operated on Tuesday, and today is only the fourth day, and I'm ready to go home. And I've really had no such great pain that I couldn't tolerate it. And very soon everything improved faster than I ever thought. And now I'm transformed, I think. I'm now looking forward to walking more and more every day. After I get discharged and I go through the normal procedure of physiotherapy and under supervision, I feel very confident that if I'm a little bit more sensible, that I don't overdo anything, I'll be walking with pleasure again. I can only thank Dr. Abhinandan Puneet, who's a young doctor, a very eminent, and the hospital owner or the proprietor, and himself a great doctor, Dr. Devi Shetty. I'm indeed extremely glad that I landed up at the right place and at the right time and the right doctor.
Hello, I am Dr. Abhinandan S. Puneet. I am a consultant orthopedic surgeon with a special interest in robotic joint replacement and sports medicine at Narayana Health City, Bangalore. Today, we are going to discuss about TKR in elderly. People often ask, am I too old for knee replacement? Now, there is no age limit for carrying out knee replacement. Usually, a knee replacement is recommended for patients who are above 60 up to age of 80 years. Now, there is certain subset of patients who are above 80 who often are physiologically fit and might benefit from knee replacement. To answer the question, there is no age limit. Even in elderly, if they are physiologically fit and they have a good health, after safe anesthetic evaluation, we can do a knee replacement in a very elderly population. This is a story of Mahavir Chakra Rear Admiral S.K. Gupta. This gentleman is 88-year-old, having osteoarthritis in his both knees. He has been suffering from knee pain from last many years. He is quite a fit individual and very young at heart, and wanted to do many things in his life, and the only limiting factors were his knees. After time and a thorough consultation, he decided that he will give a try to undergo knee replacement. We at Narayana Health City embarked the journey of carrying out knee replacement on this individual who is elderly, and we did all the necessary evaluation to make sure that he was suitable candidate for a knee replacement. After meticulous planning, we did a simultaneous bilateral robotic-assisted knee replacement. Surgery went very well, and on the same day we were able to make him walk, and with the enhanced recovery pathway, he was discharged on day 5, and he was very much delighted with his knee replacement. In coming days, he progressed